Good evening, Papua New Guinea, and welcome to another episode of Business PNG. Now, the healthcare landscape in Papua New Guinea has always been a challenging topic of discussion, though oftentimes found on the government's list of priorities. Issues such as getting medication to rural clinics and hospitals or training and qualifying healthcare workers is usually an uphill battle due to a severe lack of funds. The healthcare landscape in Papua New Guinea is informed by our topography and culture. The Highlands region is home to mountainous ranges and deep valleys, which makes access to hospitals and medication quite difficult. While in the coastal regions and Port Moresby, the growing middle class and rising incomes are increasingly leading to the kinds of non-communicable health issues more often seen in developed countries. Communicable diseases account for around 50% of mortality in the country, and maternal and infant mortality rates remain high, according to the World Health Organization. The country's complex terrain poses funding challenges to the government. However, the health sector remains the priority for the government. Vision 2050 lists the following goals for the health sector: to reduce HIV and AIDS prevalence from 1.28% of the population aged 15 to 49 to 0.1%. To reduce tuberculosis prevalence from 51 per 100,000 to 10 per 100,000 of the population. To reduce malaria deaths from 65 per 100,000 to 10 per 100,000 of the population. Ensure that the referral hospitals are adequately equipped to international standards. Establish one aid post per ward area. Provide 2 health workers per ward area. Establish one basic health service center with 2 doctors and support personnel per district. Improve the terms and conditions of employment of health officers, and to establish a health endowment fund. A national health plan was also put in place to emphasize the provision of basic care for the country's poor and rural population. The plan aligns with the PNG Development Strategic Plan 2010 to 2030, as well as the nation's Vision 2050 goals. However, more often than not, despite the goals and plans made here in Waigani, many clinics and hospitals in the wards still lack infrastructure and services. So this begs the question, where are we going wrong?
The hospital has been forced to work without surgical equipment, IV fluids, hand gloves, and laboratory reagents.
Dribbles of the government's free healthcare policy have been received. This, however, has not been enough to cater for the increase in demand for healthcare. Apart from using rundown facilities, the hospital often faces shortages in medical supplies. Earlier this year, they were forced to close the outpatient.
We had an incident where there was a mass accident and we had no gauze, so we had to cut the patient's clothes, wash them off, and then dress the patients.
Papua New Guinea government ibla masore lo ibla na lugi. Na heduwedi mol Papua New Guinea all young blood doctors blow ibla. Can you people see this?
Tubla terrible line woglo diet every day. Also the government even looks so long. Find some money come inside log cancer with that.
According to the World Health Organization, Papua New Guinea suffers from a critical shortage of human resources for health.
There is a challenge of the workforce. The numbers who are trained well or who are appropriately trained, who know about TB and dealing with TB, and the numbers are an issue, and it's everywhere in terms of the health sector and the workforce. The numbers are very, very low, so It's an urgent situation that we are working on to ensure there are enough workforce.
Also, according to the WHO, the country's health workforce is characterized by an aging workforce, low numbers of midwives and community health workers, a demotivated workforce due to poor working conditions, including low wages and poor physical infrastructure, and insufficient training capacity to produce the number of health workers to meet population needs.
In our country, health systems have gone down over the years. We are working very hard through our government's directions to ensure that the systems are brought up to a level where we can function at.
I'm Leanne Durari in Kokopo, and you're watching Business PNG. In addition to the public and church care facilities, PNG has 15 to 20 private health facilities concentrated in Port Moresby and Lae that provide inpatient and outpatient medical and diagnostic services. One such private health facility is Pacific International Hospital, located in 3 Mile Port Moresby.
Health services in Papua New Guinea can be accessed at public hospitals and clinics, as well as at church-run health centers, which supply about half of all rural health services, and at aid posts staffed by community health workers and run by local governments and NGOs. In addition to the public and church care facilities, PNG has 15 to 20 private health facilities, though concentrated in Port Moresby and Lae, that provide inpatient and outpatient medical and diagnostic services. Amongst this is the Pacific International Hospital in Port Moresby, the only private hospital in the country which offers advanced tertiary health care and medical treatment not previously available in PNG. In 2015, the company inaugurated a state-of-the-art tertiary care multi-specialty hospital, which includes a cardiac catheterization laboratory and an MRI machine. This was a result of a public-private partnership between the hospital and the People's National Congress Party.
What we need to understand here is that this is not a single point problem. This is a composite problem. And there is no magic wand or there is no panacea for all ills. It cannot be solved in one single stroke or one single action by the government. The government is doing a lot. In this sense, we are so fortunate that today we have a health minister, somebody of the likeness of Sir Pukatemu, who is a doctor himself. He's been a health secretary in this country, so he knows exactly where the shoe pinches, and they are addressing it in that context. But we also need to understand that this healthcare is a composite problem. It gets compounded by the education levels, the communications, the ruggedness of the terrain, the weather, the connectivity in terms of electronic connectivity, communication, connectivity by road, ease of getting patients to health centers. All these things have a compounding effect or a domino effect on everything that we do in healthcare. Be it providing healthcare to people in the remote locations. It starts with, sending the paramedics, the doctors, setting up facilities, the difficulty in setting up facilities, the number of people available to do such things here. Budgets is probably the last thing that becomes an issue for not being able to implement it.
According to Kanal Shaligram, raising the standards of the health sector in Papua New Guinea is the key focus of the private facility.
Today, technology, but at the same time, advancement in medicine and technology has been responsible for no more than 50% of improvements in health indices. Because as I said earlier, it's a composite problem composed of many components. Technology is just one of the components. But yes, we need to avoid duplication of resources. Resources which are there in public need to be accessible to private sector so that they are better utilized, the optimum utilization takes place. The rates could be different. Say there is a resource in the public sector which is free for the patient from public sector, but for the private sector patient it may be chargeable. At the same time, if there is a resource existing in the private sector, say PIH, the same can be made available to the public sector. It needs to be made available to public sector. It could be on a very low rate, just covering the cost. In any case, there are excess capacities available. These capacities need to be utilized.
Also, according to Shaligram, the best way for PNG to deal with its health needs is through public-private partnerships.
The health minister in this context has given us a direction how the private sector can enmesh and have a symbiotic relationship between the government health initiatives and the private sector. As a result, we have been doing our outreach programs in so many of the remote provinces. We are also looking at augmenting facilities in the health centers with the additional facilities and the kind of reserves that we have here. All these facilities need to reach out to the people in the remotest of the places. Now, another thing which I would like to bring at this point is there is a great amount of development which has taken place in telemedicine. Telemedicine in the sense, first is that how a patient at a remote location can be treated by a doctor who is not present there. Fine. Telemedicine equipment today gives us that kind of a reach where a patient, including his vital parameters, including his heartbeat, everything can be checked by a doctor who is available at a remote site. All you need is to have one person who requires very little amount of training to be present with the telemedicine equipment.
I'm Leanne Gerari in Port Moresby, and you're watching Business PNG. Thank you, Mr. Midgley, for your time. Can you tell us a little bit about your company?
Yeah, thanks for having me. Pacific Project Logistics is a specialised marine logistics provider in Papua New Guinea. We specialise in a wide range of niche services, including agency, vessel chartering, cargo transport, and crew transfers for the oil and gas and resource sectors.
Okay, so would you classify it as a SME, a small to medium enterprise?
Yeah, definitely. We're definitely an SME. We've got about 120 staff at the moment.
Okay, and you're based here in Port Moresby?
Yeah, our head office is in Port Moresby.
Okay, all right, so you're here at the Petroleum and Energy, the second Petroleum and Energy Summit. Tell us a little bit about that. What's your connection to the extractive industries?
Pacific Project Logistics has a very close connection with a lot of the people that are presenting here at the moment, and this is where our market is. So for all the oil and gas developments in Papua New Guinea, usually PPL will have some input and some sort of service that we're providing to the market. The Gulf Province and Western Province are a big focus for us, and so we're here to support our clients. So they are the project developers. So.
Okay, all right. So would that be Total and in the Papua LNG?
Yeah, correct. Total is a client of Pacific Project Logistics, and we work very closely with them every day of the week for the last couple of years. So we're actually developing a lot with Total at the moment, and it's good to see their operation going well.
Okay, thank you for that. Tell us a little bit about your company. As you know, as you're aware, right now the economic downturn, there are a lot of challenges that Papua New Guinean businesses are facing. Tell us a little bit about how you are with this current environment.
Yeah, we see the current economic climate and the challenges that are in the market at the moment as challenges that can be overcome. I think these are the times when you really see who wants to be in PNG and who's got a long-term plan for PNG. It's not a time to hide and run and hide at the moment. It's really a time to look at how you can increase your efficiencies in your business and how you can work together with your clients to reduce their costs as well. Because at the end of the day, there's a very resource-rich country, and we're going to see things come back. So for us, it's been a time of actual development. So we've invested heavily in PNG during this period, and we're going to continue to do so. We feel very strongly about the future in Papua New Guinea.
There's a lot of optimism there, and it's something that I appreciate. However, Papua New Guinea is ranked 109 in the World Bank's Ease of Doing Business list. Is there any rankings, rather? Is there any challenges that you face in terms of doing business in Papua New Guinea?
Lots of challenges. Yes, it is a very challenging place. I mean, being in logistics, We're faced with challenges every day in terms of how we actually deliver our services, but in terms of running the business, yeah, I mean, it's the same same challenges that everyone else is experiencing. I'd say probably the biggest challenge that a lot of companies have at the moment is the Forex issue. So being a company that relies on international trade or facilitating international trade as part of our business, it is a challenge. So we just have to work very closely with our banks and come up with solutions. It's a problem for everyone. So the relations that we have with our suppliers and our clients and our contractors is one where we can work together, and things are taking a little bit more time to process than they usually do, but more than they used to. However, we can overcome it, and hopefully there's a bit of light at the end of the tunnel in the next 12 months, 12 to 24 months.
So that's a great segue. I want to bring back into remembrance yesterday at the first day of the summit, Prime Minister Peter O'Neill mentioned he placed a heavy emphasis on public-private partnership. So tell us a little bit about how your company can, benefit from a public-private partnership, and if there's any message that you want to give to the government in terms of, easing of the burden of taxes or other things, other challenges. This would be a great platform.
Okay. Well, I'll talk from the operational perspective on this one. So we're looking at opportunities that we can work with the government, because the problems that we are having as a business are also problems that the government is having as well. So for instance, getting material in for essential services. I mean, we're in the marine industry, so you look at it, some of the governing bodies of that industry, they're having some issues too. So we're trying to team with them and work out a solution where it's an industry solution that also benefits the government input as well. So we can all work together basically to come up with a solution to these problems. So we have a lot of involvement with different government agencies, whether it be Customs or National Maritime Safety Authority or PNG ports. So and even in the provinces as well. So we're pretty heavy in the Gulf, heavily invested in the Gulf and Western Province. So we look to see where we can assist with their plans as well, because it needs to be a partnership. And with these projects that are happening there, and we'd like to give something back as well. So we look at ways constantly where we can do that.
Yeah, okay. Thank you for that. What does the future look like for Pacific Projects Logistics?
Pacific Project Logistics, I mean, we're very confident. We're long PNG. We're here for the long haul, and we're very confident in project developments in Papua New Guinea, and not just in the oil and gas sector, but in mining and in infrastructure. There's a lot of infrastructure projects around the country, and I think there's going to be a big push in the Gulf province over the next few years, and I think we're well established now as a business where we can really add a lot of value to our clients and our partnerships. So we're very excited about what the future holds in Papua New Guinea.
So what differentiates Pacific Project Logistics to other logistics companies in Papua New Guinea right now?
Okay, so PPL has invested heavily in a lot of our equipment and our facilities. So our goal really is to become a service provider that it doesn't have to outsource a lot of our services, as is a typical model in the logistics with logistics companies. So we have our own vessels, we operate out of our own wharf facility. We have an engineering business which supports the maintenance, repairs and maintenance of our vessels, which allows us to keep a lot of that in-house, and through that actually expands our business as well, where we offer those services, especially with the slipline engineering, to third parties. With the equipment that we've got, that PPL or Pacific Project Logistics has, we've got some very specialised equipment in terms of our fuel handling, so the pumping equipment and the safety gear that we're sending up to these sites. And we've got a really strong local workforce with a wide range of skill sets as well. So we're not just sitting behind a desk coordinating things at the desktop. We're actually out in the field, boots on the ground. So I think it's a different model to a lot of the other logistics companies here. We also have very strong relations with overseas. We're agents for a lot of overseas companies as well. Okay. So that really bolsters what we are. We're not just a Papua New Guinea company sitting here working on the local market. We're working globally or within the region. So yeah, we've got very good alliances with companies overseas for that.
Thanks for that. Is there anything else, any additional comments you'd like to add?
I'd just like to reiterate PPL, Pacific Project Logistics, we're very excited about what the future holds in Papua New Guinea. We're heavily invested here, we're here for the long haul, and you know, these projects that we're here discussing at conferences such as this are a very good sign of what's to come in Papua New Guinea.
Thank you, Mr. Midgley, for your time.
Thank you very much for having me.
And that's all we have for this episode of Business PNG. For more information, or if you would simply like to view this episode again, visit EMTV online at the URL at the bottom of your screen. Or for more information and to simply join the conversation, like our page on Facebook or follow us on Twitter at the Twitter handle at Business PNG. Until next week, have a pleasant evening. I'm Leanne Jarari, and this was Business PNG.